Before we turn to questions, I'd like to provide an update on something we started discussing on Friday, which are some changes that Maine CDC is making to the way in which we investigate cases of COVID-19. On Friday, we talked a lot about the significant increases in cases, outbreaks, hospitalizations, and sadly in deaths that Maine has experienced in recent weeks. For example, with respect to the number of cases, the 7-day moving average of new daily cases in Maine now stands at 291. Just 1 week ago, it was 168. That's a 73% increase just in 1 week. Today, right now, there are 170 people in the hospital. 1 week ago, it was 139, a 22% increase in hospitalizations just in the last 7 days. A week ago, our positivity rate was about 3.95%. Today, it's 4.7%. And quite sadly, just in the past 7 days, 33 Maine people have died with COVID-19. For weeks now, Maine CDC has been anticipating and preparing for this increase. We have redeployed internal staff. We've brought on members of the National Guard. We've worked across the Department of Health and Human Services to bring on and identify additional staff to assist, and we have been hiring and hiring. We are not slowing down with any of those processes at all. But sadly, we were already experiencing a surge of cases, and last week, things accelerated even more, and we began experiencing a surge on top of a surge. This week, too, started off with the confirmation of concerns that we foreshadowed a few weeks ago. An increase of cases starting today with 427 cases today. Over the past few days, Maine CDC has identified two interrelated concerns. One is the rapidly growing number of lab reports that we must review every single day. And then related to that, our obligation to assign them for investigation, ensuring we can focus on the highest risk, most vulnerable individuals. Now, before I go into this a little bit more, I'd like to pause for a second to talk a little bit about the process that happens between when someone gets tested for COVID-19 and when a full case investigation gets launched. When a person goes to a lab, any lab, and gets tested for COVID-19, if that result is positive, it gets reported to Maine CDC, either electronically or by fax. Each and every one of those positive lab reports has to be reviewed by somebody. That somebody has to determine whether that is a new case of COVID-19 or whether it is an existing person, for example, who has already been logged in our system. So for example, some people get multiple rounds of COVID testing as part of treatment they're getting. We need to make sure that when we get a new lab result, we're not double counting cases. We also need to make sure that the lab results we get are not duplicates. Maine is what is called a dual reporting state. That means that Maine CDC often gets two versions of the same positive lab report, one of which might come from the laboratory, the other of which might come from the person's doctor. Every one of those lab reports that we get electronically or by fax has to go through a process to make sure it's not a duplicate or that it's not the same lab result on someone who's already tested positive. All of that requires a thorough review to ensure that when we have a case, it is a new case, not an existing case. Accuracy matters in this process because what's at stake is an accurate daily case count. In recent days, we've developed a gap. The number of new lab reports that has been coming into Maine CDC has exceeded our ability to do that review process on a daily basis. For example, on Friday alone, we received 650 such reports. Now, we foresaw that this increase was coming, and we believed we could keep up with it. But the surge on top of the surge that we saw last week challenged that process. Now, let me be really clear here. This is not a backlog at the Maine CDC laboratory. And this number of cases that we still have to review does not affect things like our positivity rate or the number of people in the hospital. All the same, we faced this issue and we knew that we needed to make some changes. There was another companion concern that arose, which is what we do with those cases after we have confirmed them as new cases of COVID-19. As I mentioned on Friday, we spent time analyzing the set of choices that we had in front of us, with a focus of preserving our ability to address the needs of the highest risk individuals in our state, as well as those they care for or who care for them. These discussions and decisions were extremely difficult, and they were unpalatable, but they were also necessary in these times of an unprecedented surge. As I discussed on Friday, the sustained increase in numbers of new cases and numbers of new daily lab reports has outpaced Maine CDC's ability to continue the approach that has taken us where we are right now. As a result, we have had to make some changes to the way that Maine CDC operationalizes the way that we go about investigating cases. I'd like to walk through those now. Until now, every person who tested positive with COVID-19 received a case investigation from Maine CDC. But in light of the significant number of increasing new cases, Maine CDC is announcing the following changes to our case investigation protocol. We will continue to conduct case investigations within the following groups: those who are aged 18 and younger, those who are aged 65 and older, people identified on their lab report as being a healthcare worker or a first responder, people who are hospitalized, people who are identified on the lab report as being part of a demographic that has had a higher burden of disease in Maine, people who are identified as having a disability, or people who are known to be living in or working in congregate living settings, like certain healthcare facilities, nursing facilities, shelters for people experiencing homelessness, group homes, or correctional facilities, and finally, individuals known to be associated with schools or childcare facilities. Individuals in those groups will continue to receive a full case investigation. Individuals who fall outside of those groups may not receive a full case investigation. However, they will continue to receive notification as well as offers of assistance and support from Maine DHHS. Maine DHHS is creating a new service whereby individuals who do not fall into one of the categories I mentioned will continue to receive notification from the state of Maine of their positive lab result, as well as offers of assistance so that they may continue to go through the isolation process safely and without incident. That outreach will ensure that they know of their positive case status, they know the basics on what to do in order to isolate and stay safe, and they know how to access social supports. The changes that I've outlined here have been very challenging. The discussions were not easy. There were no easy choices in front of us. As of this morning, the number of laboratory results that are awaiting review to determine whether they are duplicates or whether they are already individuals who are in our system had grown sadly to over 4,000. we are making efforts as quickly as we can to bring that back under control. The changes that we are making to the case investigation process in the categories I've mentioned will similarly enable us to focus our available public health resources on caring for the most vulnerable residents in Maine, our elderly neighbors, those who are living in congregate living settings. It will also allow us to focus our available resources on those who care for them, like healthcare workers and first responders. The bottom line for everyone is that right now, for where we are in the COVID-19 pandemic, Maine CDC finds itself sort of in the position of a very busy, crowded emergency room. And just like in any emergency room, we have to take our available resources to make sure we are serving those who are in the highest need at their greatest moment of need. These choices are difficult, but let me end by talking about what this change means for you. First of all, this is a change that's internal to Maine CDC. It does not affect things like testing or PPE or clinical treatment or the care that you may receive if you were to go to your healthcare provider. It means that if you test positive for COVID-19, the very first thing I'm asking you to do before you hear from anybody from Maine CDC or before you may hear from your healthcare provider, the first thing I'm asking you to do is to promptly isolate, to separate from others so you don't have you lower your risk of spreading COVID-19 to others. The other thing I'm asking everyone to do is that if you test positive for COVID-19, before you hear from anybody, please think about the folks that you have come into close contact with, and please notify them as soon as you can. If you are in one of the higher risk categories that I mentioned, you will hear from Maine CDC, and we will develop a list of your close contacts and reach out to them. But before that process happens, please do so yourself. If you are not in one of those high risk categories, going forward, you will not hear from Maine CDC. And we are asking you to help us make sure that you can notify your close contacts as soon as possible so that they too can quarantine for 10 days. I'll close with this. These choices are incredibly difficult, but as Commissioner Lambrou and I have talked about, we are in a position where there are no easy options in front of us. We at the state will continue to do everything we can to continue the processes, to bring more people on, to hire more, and to continue staying on top of the virus as much as we can. But sadly, we're in a situation where, just like at the emergency room, some difficult decisions have to be made. The pledge that I've always tried to maintain is that whether there's good news or bad news, I want you to hear it from me first, with an explanation of why we're doing so and what this will enable us to do. In this situation, this is difficult news, but I want you to hear it from me and from me first, with the understanding that we do so in order to keep our focus on the most vulnerable Maine people and those who are helping them in the healthcare community and elsewhere.